Dear students, today we are going to start a new module, mental health. In simple terms, mental health can be described as a level of psychological well-being or an absence of a mental disorder. This is a simple definition for mental health. But according to WHO, mental health is not mere the absence of a mental disorder. WHO is focusing on four aspects, that is, a person who is in a state of mental health should be able to realize his or her own potential. So, a mentally sound person should be able to identify his potential, and he should be able to cope with the normal stresses of life. You know that there are normal stresses of life, that is, the situations in the daily life are variant, and these can cause stresses which are normal, and the person should be able to cope with these normal stresses of life, and he should be able to plan his life activities accordingly, and he should be able to work productively and fruitfully. That is, the person should be able to identify his own potentials, and he should be able to identify his limitations, and he should be able to cope with the normal stresses of life. Finally, he should be able to plan his activities accordingly so that his work is productive or fruitful. And ultimately, all these are helping the person to make a contribution to his or her own community. So these are the four different aspects as defined by WHO about mental health. Then why mental health is so important? A good mental health, it is very essential to lead a long and healthy life. So a good mental health is very essential to enhance the life standard of a person, and a poor mental health will prevent the person from leading a normal life. And we can say that there is no health, absolutely there is no health without mental health. So a person can be called healthy only if his mental status is also okay. Health does not mean that the mere absence of a physical illness. A person can be called completely healthy only if his mental status is also healthy. Then mental disorders, they are the major contributors to illness and premature death, and they are responsible for 13% of the global disease burden. 10th October of every year is observed as the World Mental Health Day. Then let us see the mental illness. Mental illness is a mental health condition that has a negative effect on the way in which an individual thinks, feels and behaves. So mental illness, it is actually defined as a condition that is negatively affecting the thought, feeling or emotions and behavior of a person. If there are variations, if there are negative effects in the thought of a person, or in the feelings or emotions of a person, or in the behavior of a person, we say that he is having a mental illness. So mental illness refers to a group of psychiatric disorders in thought, mood or emotions and behavior of a person. When we talk about mental illness, there are two branches of science, that is psychiatry and psychology. Psychiatry is the medical specialty that diagnoses and prescribes medical treatment for mental illness. So if a person approaches a psychiatrist, he will diagnose his mental condition and he will prescribe certain medicines. So the person has to administer these medicines for the treatment of his mental illness. Then psychology, it is the discipline that studies normal and abnormal behavior and applies counseling methods to treat mental illness. So psychologist is different from psychiatrist. Psychiatrist is a medical doctor who is prescribing medicines for the treatment of mental illness, whereas psychologist is a person who is studying the normal and abnormal behavior of a person, or he is studying the variations in the behavior of a person, and he is applying counseling methods. Instead of giving medicines, he is applying counseling methods for the treatment of mental illness. Then some people suffering from mental illness may not look as though they are ill. Sometimes mentally sick persons may look physically okay. They look physically okay, that we don't have a feeling that they are mentally ill, while others may appear detached and withdrawn from society. So people express mental illness in different ways. Some people who are having mental illness may look physically okay, but they will be having some sufferings, or they will be having a poor mental health status. Whereas some other people who are having mental illness, they appear detached and they will remain withdrawn from the society. They always like loneliness. So people express mental illness in different ways. Then there are different factors that influence the mental health. First one is anatomical differences in the brain. Sometimes the person will be having variations in the brain size. For example, in the case of mentally retarded persons, the brain size will be reduced. So the brain size is a factor, or it is an anatomical difference that is contributing to mental health. Then there can be altered neural connections due to physical insults to the brain and neuron degeneration. Suppose if a person is encountering an accident, and after the accident, sometimes an injury, physical injury can occur to the brain, and this can alter the neuronal connections, or it can result in neuron degeneration, and the mental status of the person can vary after that accident. So these are the anatomical differences in the brain that can contribute to mental health. Then genes. There are genes which code for specific neurotransmitters. The functions of the brain, the functions in the brain are carried out by certain chemical substances which are produced by the neurons, and these substances are called neurotransmitters. And the specific neurotransmitters are coded by the genes which are present in the DNA. If there are variations in the genes, these neurotransmitters that are produced will be different, and the neuronal signals that are processed in the brain will also change. So there are genes which are inherited from the parents, which can alter the neurotransmitter production. So some types of mental disorders are inheritable. That is, if there are variations in the genes responsible for the production of neurotransmitters, and these genes can be inherited, and the mental disorders can run in the family. Then chemical messengers or the neurotransmitters. If there are variations in the regulation of the neurotransmitters, or if there are excess activity of the neurotransmitters, then it can result in mental illness. Then age and gender are the other factors that influence mental health. For example, mood disorders like depression and anxiety disorders, they are most common in women than in men. So the anxiety disorders and the depression, they are mostly found in women. Whereas disorders like antisocial personality disorder, then substance abuse disorder, these are most commonly found in males. Then ADHD, that is attention deficit hyperactivity disorder, it is more common in males prior to the age of 7. That is, it is more common in male children. Then degenerative disorders involving memory loss or dementia, that is most commonly found in adult males. That is, it is occurring due to the neuron degeneration, age-related neuron degeneration, that is involving the loss of memory or dementia. It is most commonly found in males. So these are the factors that influence the mental health of a person. Now coming to the common warning signs of mental illness. If a person is feeling very sad or withdrawn for more than 2 weeks, he can be having a mental illness. Then if a person is trying to harm or end one's life or making plans to do so, that is, if a person is having a tendency to harm himself, or if he is expressing a suicidal tendency, it can be a sign of mental illness. Then the person will be having severe out of control risk-taking behavior that causes harm to self or others. He will be showing dangerous, adventurous behavior or risk-taking behavior which can cause harm to himself or to the others. Then the person can express sudden, overwhelming fear for no reason. There will not be any reason, and the person is expressing overwhelming fear or excess fear, and it can result in the raise of the heartbeat, or there will be some physical discomfort or difficulty in breathing. So the person is expressing severe fear towards something without any reason. This can be a sign of mental illness. Then there will be significant weight loss or gain. Sometimes people may avoid food because of some mental status. The people may avoid food, and this can result in the loss of body weight. And some other people can have excess food to reduce their mental stress. They will have excess food, and this can result in the putting up of weight. Then seeing or hearing or believing things that aren't real, that is, they will have some hallucinations, and they will see or hear something which is not real. This can be a sign of mental illness. Then excessive use of alcohol or drugs. People will use in order to reduce their mental stress, they can use excessive use of alcohol or drugs. Then drastic changes in mood, behavior, personality or sleeping habits. There will be wide variations. There will be drastic changes in the emotions that the person is feeling, and there will be variations in the behavior. Sometimes he will be very sad, and sometimes he will behave very violently. So there will be variations in the behavior of the person or in the personality of the person, and there will be variations in the sleeping habit. Sometimes the person will not sleep, or he will sleep excessively. So there will be variations in the sleeping habit. Then he will be having difficulty in concentrating or staying still. Then there will be intense worries or fears that get in the way of daily activities. The person will have intense fear, so that it is actually preventing him from doing his normal daily activities. So these are the warning signs of mental illness. Now let us see the mood disorders. There are different mood disorders. Only one type of mood disorder we are discussing today. That is, first let us see what is a mood disorder. A mood disorder involves a disturbance in a person's emotional state or mood. If there is a drastic change in the emotion or the mood of a person, it can be called a mood disorder. This mood disorder can be expressed in the form of extreme depression. Sometimes the person will be extremely sad, or excessive elation. That is, the person will show, he will express emotion, he will express his happiness to a very extreme extent. That is excessive elation, or a combination of these emotional states. Sometimes the person will switch over from sadness to excessive happiness. So these two extremes of emotions will alternately expressed by the person. So these are the different forms of expression of mood disorder, that is extreme depression or excessive elation or a combination of these emotional states. First, let us see the depressive disorder. The primary characteristic of depression is that the individual feels overwhelming dysphoria or sadness. This is the most common type of depressive disorder. The person will show excessive sadness or dysphoria. Then there are persons who show bipolar disorder. That is, the person will experience will show emotional experiences at the opposite poles. That is, he will switch over from overwhelming sadness or dysphoria to feelings of elation or euphoria, that is excessive happiness. So the person will show these two, will express these two emotions alternatively, that is bipolar disorder. Sometimes he will laugh very loudly, or sometimes he will weep very loudly, he will cry very loudly. So this is a form of bipolar disorder, that is the person is switching over from one extreme state of emotion, that is sadness, to the extreme state of happiness. Then there are two serious forms of depression, that is major depressive disorder and dysthymic mood disorder. So we are discussing the mood disorder, that is the mental illness. Today we are discussing about major depressive disorder and dysthymic mood disorder. Major depressive disorder, in this state, the person will express a dysphoric mood, that is, the person will feel extreme dejection or dramatic loss of interest in previously pleasurable aspects of life, and he will show impairment at work and home. Sometimes the person will be interested in watching movies, listening to music, or he will be interested in doing some activities which is productive. He will be interested in some productive activities. But if a person is in a dysphoric mood, he will feel extreme dejection and he will lose interest in all the pleasurable activities which he liked previously, and he will remain abstained from all these pleasurable activities, and this can affect his activities at home and also at the office. So he will not be able to produce any creative result. So this is the dysphoric mood. Then there will be physical signs of major depressive disorder, that includes somatic symptoms and cognitive symptoms. Somatic symptoms are the symptoms which are expressed in the body. The person will show lethargy and psychomotor retardation. Sometimes the person will sit or lie down somewhere idle, so that he is not interested in doing any activity. So there will be psychomotor retardation or lethargy. Sometimes people show psychomotor agitation. They will express their emotions violently. They will throw things. So they express emotions violently because of psychomotor agitation. Then there will be significant unintentional weight loss. Sometimes people may remain very sad, so that they will avoid eating food, and this can result in significant weight loss. Then there will be appetite increase or decrease. Sometimes people will try to combat the depression by eating more food, so the appetite will increase. Sometimes people will avoid food, then the appetite will decrease. So there are individual variations in expressing major depressive disorder. Then there will be change in the sleeping pattern. Sometimes people will not be able to sleep, that is insomnia. Sometimes people will sleep excessively, that is hypersomnia. So there are individual differences. Then coming to cognitive symptoms, the person will have intensely negative self-view. He will always think negative about his self. then he will have a very low self-esteem, feeling of worthlessness or inappropriate guilt. He will always think about his past mistakes, and he will curse himself, and he will always feel worthless. He will always feel that he is not worthy of living. Then he has a feeling that he deserves to be punished. He will always self curse, and he will always think about his past mistakes and curse himself, and he will always have a feeling that this should happen to me because I was such and such person in the past. So he will always have a feeling that he deserved to be punished. So he will have a low self-esteem. And the person with a major depressive disorder will have concentration difficulty. He will not concentrate in the work that he is doing. So he is having concentration difficulty, and he will be having indecisiveness. That is, he is not able to take a decision in the matters in his life. So there is indecisiveness. Then there will be recurrent thoughts of death or suicide. He will have a suicidal tendency. So these are the symptoms of major depressive disorder. This is the slide which is summarizing the symptoms of major depressive disorder, that is variations in the emotions in the form of sadness, anxiety, irritability, helplessness and mood swings. Then variations in the thoughts, that is self-criticism, indecisiveness, then a tendency to believe others see you in a negative light. A person with a major depressive disorder will always think that others are viewing this person in a negative mode. Then the behavior, there will be variations in the behavior, that is crying spells. A person with a major depressive disorder will often cry. Then withdrawal from others and loss of motivation. Then variations in the physical status, that is lack of energy. The person will feel lethargy, and there will be psychomotor retardation. Then unexplained aches and pains in the body. There will be aches or pains in some parts of the body, and there will not be any reason for this pain, but the person is experiencing the pain or the ache. That is a symptom, physical symptom of depression. Then overeating or loss of appetite. So these are the symptoms of depression. Then the next mood disorder is dysthymic disorder. It is also called dysthymia, and it is a form of depression that is usually lasting up to 2 years. Sometimes people may express this dysthymic disorder for longer duration, for several years of time. Then dysthymic disorder, it involves sadness. Here also, in the case of dysthymic disorder, like in the case of major depressive disorder, the person is expressing sadness, but the sadness is not as deep or intense as the case of major depressive disorder. In the case of major depressive disorder, the person is experiencing a very intense sadness or deep sadness, so that he is having a very intense negative self view, and he is developing a suicidal tendency, or he is remaining abstained from the society. But in the case of dysthymic disorder, here also the person is experiencing sadness or depression, but it is not as intense or deep as that of major depressive disorder. So the person is not having any suicidal tendency, but there is some sadness or some distress which is quite long lasting, for at least 2 years. If a person is having a sense of sadness or depression which is long lasting, and if it is lasting up to 2 years or more, it can be called dysthymic disorder or dysthymia. So these are the symptoms of dysthymia. Here in this case, the person will have a low energy or fatigue. The person will not be interested in doing anything. Then he will be having a low self-esteem. Then there will be poor concentration. Then he will be having difficulty in decision making. Then the person will be having feeling of hopelessness, and there will be appetite disturbances, and sleep disturbances will also be there. But these symptoms are not as deep or as intense as in the case of major depressive disorder. So the person is not developing any suicidal tendency, but these symptoms are lasting for a longer duration of time, sometimes up to 2 years or longer. So that is about dysthymia. So in this today's class we have discussed about the mood disorders, and the other types of mental illness will be discussed in the next class. Thank you.